Traditionally, the compartmental models in epidemiology are named SEER models: S for susceptible population, E for exposed population, I for infective population, and R for removed population, those who has been infected and now are dead or recovered. The shape of the curves the models that analyze the propagation of an infection are well known. In a case without any kind of containment measures, we will expect that almost all the population become infected and finally removed from the dynamic. But since we already know the shape of the curves, why is needed to study it? Well, we don't know at least two important elements. First, the time needed to the curve to evolve, and second, the size, the height of the curve. This second parameter can cause that a system collapses. Also, like is the case of the COVID, we didn't yet know exactly the parameters that drive the curve. Hence, a lot of analysis must be done. Obviously, nobody wants to saturate the health system, hence some measures the policymakers must assume, like a confinement. Look the difference on the shape that represents the number of infected people in one scenario without confinement and other with confinement measures. Here a new curve appears. On yellow, the people that is confined, hence not affected by the spread of the infection. This is not so easy as it seems, since the more important component here to be able to understand this in detail and obtain a good prevision is the human behavior. This will lead us to define a detailed model that allows to understand these curves with the goal to test different containment measures and test its effectiveness.
Right now, we are all confined, and we are changing the way that we are establishing relationships and working. The mitigation alternatives we're facing are changing our lives. In this context, the goal of the project is to develop a functional prototype that allows to evaluate pandemic containment alternatives, based on a graphical conceptualization of the models, which represents the modeling hypothesis.
The system must allow it to expand by incorporating new working hypotheses and using on two fundamental sources: data on the evolution of the pandemic, data showing the past, and sensor data, mobile phones or other devices, showing a present vision of the situation. This will allow to define forecasting models of the propagation of the pandemic from the analysis of citizens' behavior. The model must also be able to expand its semantics and computing capabilities from, for example, co-simulation, to include models of traffic management, evacuation, and much more. Along the web application, we will define a working methodology that allows to establish a common framework for the different specialists, who must collaborate in the definition of complex models. This allows us to understand the hypotheses that govern the models and, from them, to understand the causality that derives from the multidisciplinary knowledge provided by specialists from different areas. With these ideas, we compose a team that is structured in three main areas: modeling, codification, and validation. The modeling team is composed by MD in Computer Science Jorge Luis Silva Barcelos, physicist Víctor García, and Dr. Pau Fonseca. MD Computer Scientist Joan García and José Luis Pérez, along with Dr. Pau Fonseca, will compose the codification team. The validation of the proposal and the resulting tool will be carried out by the Catalan Institute of Oncology and a team of doctors from the Hospital Clínic de Barcelona, and led by Dr. Josep Maria Ribera, Dr. Eric Cobo, and Dr. Jaume Llopis.